welcome to this World Suicide Prevention Day conference and Service of Remembrance. Thank you for joining us today. We're very pleased to have some additions to the agenda, including Imam Kazim Fatai and Dr. Nicola Byrne, Deputy Medical Director and our Quality Centre Joint Lead for Patient Safety. We've posted some links to the Samaritans page and the helpline in case any of you would like to access those, and you can also access crisis support from SLAM. The link is in the question and answer function. Please also remember there are really good resources on Mind's website for anything relating to suicide prevention. Thank you very much for joining us today, and please do feel free to post your comments, thoughts and feelings here. If you'd like a reply to any of your questions, please do also post your contact details. And just a reminder that this is a public event and will be available to watch again. I'm now going to hand over to Simon Sharing, who's the Deputy Director of Nursing and the Director of Quality. So thank you, Simon. Simon, I think you're on mute.
Sorry, I'm off to a good start. Welcome and thank you for joining our event to mark World Suicide Prevention Day. This subject's very important to me for personal and professional reasons. I've been affected by suicide in my working life, but I've also been affected by suicide in my personal life because there was a suicide in my family. So I'm very aware of how painful it is to lose someone through suicide. We're pleased to be working with colleagues from NHS England and NHS Improvement, the National Confidential Inquiry into Suicides and Homicides, and Thrive London, alongside our chaplains, to deliver this event today. And I want to thank everybody who's come together to deliver this event, and to thank everyone who's working to try to prevent suicide. And I am really pleased to introduce our first guest speaker, Angie Middleton. Angie's the Patient Safety Lead for Mental Health for NHS England and NHS Improvement. So thank you, Angie. We'll be joined by Angie in one moment.
Direct oversight.
Angie, I'm really sorry to interrupt, but can we just hear from you again? If you could introduce yourself again, if possible.
Of course. I'm Angela Middleton. I'm the Patient Safety Lead for Mental Health for NHS England and Improvement in London. I have oversight of all of the mental health suicides within the capital. Can I just check that you can hear me?
Yes, we can. Thanks, Angie.
I'm privileged to have been asked to open the South London and Maudsley World Suicide Prevention Day and Service of Remembrance. We've all joined on today. We've all joined the event today, as suicide and self-harm and prevention of suicide is important to all of us. Simon has mentioned that it's personally affected him as well as professionally, and I recognise that professionally and personally the effects of suicide and self-harm may have an impact on many of us today. It is recognised and acknowledged, certainly, that mental health services over the years, over the decades, have been underfunded and undervalued. However, over the last few years, there's been a clear direction and a clear commitment, nationally and regionally, to reduce suicides. I think we'd all agree that we'd like to be in a position, I certainly would be, where suicides have reduced significantly. And we also knew that where we have a missed suicide, we actually didn't know it was a missed suicide. So therefore, all the interventions that we've put in place for someone had actually worked. I just want to take a moment to think about why we're here today. So each year, on the 10th of September, all organisations and communities across the world come together to raise awareness and consider some interventions that could prevent suicide and suicide attempts. I'm not going to go into detail about figures because other colleagues will be speaking about that later on today, but I just wanted to touch on a couple. In London, there are more than 12 people that take their own life per week. In 2019, there were over 5,500 suicides registered across England and Wales. And globally, it's estimated that there are over 800,000 people die due to suicides each year. I'm sure all of us would agree that these figures are incredibly stark. Last year, I was invited by Simon to speak at the Maudsley's World Suicide Prevention Conference, and the international theme for 2019 was working together to prevent suicide. And I was really pleased to be at that event. That was when the Trust launched its suicide prevention strategy. However, little did we know we were about to face a worldwide pandemic. This pandemic would challenge us physically, mentally, and sadly shine harsh light on some of the health and wider inequalities that exist within our society. COVID-19 has affected us all in many different ways and brought new and increased challenges for many of us. Across London, our health and social care services have greatly been impacted. This can certainly be seen across the mental health services right across the capital. And I have no doubt, and I have seen some of the figures, that this has had a significant impact on the mental well-being of those accessing our services. So I think it's really important just to thank everybody at this point, and all of those that have worked through these unprecedented times and continue to work through them. Despite that, there's been positive impacts. And those positive impacts have been, professionally, it's been bringing new ways of working, aligning systems in days and weeks rather than taking years and months, etc., and working across boundaries and making new professional connections. Certainly in my personal life, it's made my friendships a lot stronger. It's made I've connected with my neighbours, and I've certainly been doing work in my communities. It's no surprise then that this year's World Suicide Prevention theme is about connections, and quite rightly so. It's connections and self-care, particularly thinking about nature. I think, certainly from my perspective, and I'm sure you would all agree, if ever there was a time to collectively support the mental health and well-being of our families, communities and colleagues, it is now. This afternoon, we're going to hear from Dr. Pauline Turnbull, Project Director from the National Confidential Inquiry into Suicide and Safety in Mental Health. And Pauline's going to talk about suicide prevention during COVID-19 and what we've learned. John Drew Hunley, who I work very closely with, is the Suicide Prevention Lead for Thrive London. John Drew's going to talk about making London a zero suicide city. At 15:25, there'll be a service of remembrance for people of all faiths or none. And this is really a time for all of us to reflect, a time for us to reflect and remember all those that we've lost. Once again, I'd like to thank you for participating in today's event. Whilst you're listening to the speakers, there's a couple of things that I'd really like you to think about. Now is a time to capitalise on reducing suicides across London. Take a moment to think about how I can do it, how my team can do it, how my local area can do it, and how my family can support this. Also think about connecting. Think about the theme for 2020. How can we ensure that we're connecting with others, looking after not only those that we care for, but looking after ourselves? Thank you very much for listening. I hope you enjoy the afternoon, and I'll hand back to Olivia. Thank you.
Thank you very much for everyone. That was Angela Middleton, Patient Safety Lead in Mental Health for London, NHS England and NHS Improvement. I'm now going to hand over to Pauline Turnbull, Dr. Pauline Turnbull, who's the Project Director from the National Confidential Inquiry into Suicide and Safety in Mental Health. Thank you, Pauline.
Thank you, and thank you for inviting me to be a part of this day. As a researcher, I quite often take a minute at the beginning of these kind of presentations to acknowledge the impact of each individual suicide. I'm very used to presenting very large numbers, but we never forget that each one of those numbers is an individual life lost to suicide, and alongside that, many, many more people affected. So I'm especially appreciative today that this brief presentation that I'm going to give stands alongside this service of remembrance, which I think is a chance for us, as the other presenters have said, a chance for us to reflect, to acknowledge the impact of suicide on our lives, personally and professionally. Can I have my slides, please? Thank you. First slide, please. Thank you. So thinking about the numbers, some of you will have seen these most recent published figures, published just last week by the Office for National Statistics. And this is looking at suicide rates in England, the graph on here is particularly England, all the way up to 2019. But one of the first things to say about these numbers is that these are based on registrations of death. And registrations of death happens after a coroner's inquest has occurred, and coroner's proceedings can take really quite some time, on average around 6 months, but often really quite a bit longer, particularly in cases where the death has been particularly complex. So the figures that have been released now relate to registrations in 2019, and there are some preliminary figures for the first quarters of 2020, but it's important to say that these don't relate to COVID-19. These are deaths that occurred far before the current pandemic. But it's useful for us to see what the pattern is in suicide rates over the previous few years, what lessons we can learn from this. You might have seen a similar graph to this before. What you can see here is throughout the 1990s and early 2000s, we saw a fall in suicide rates in England to a record low in 2007. We then saw a rise in suicide rates following the recession, and more recently a fall, but the last couple of years those rates have risen again, and actually the figures published last week showed a 5% increase in suicide rates from the previous year. So what might be happening to explain this recent rise? Well, it's important to say, some of you may know, that there's been a lowering of the threshold for a conclusion of suicide at coroner's inquest. And that might mean that some instances where deaths may previously have been recorded as something other than suicide are now being included in these national figures. There's been no rise, interestingly, in the youngest people. There's been no rise in the rates of suicide amongst the youngest people, but actually what we are still seeing is a particular high in this group that's been a sustained rise over the last 10 years. So something is going on with our children and young people to increase the suicide rates over quite a sustained period now. And we think that something else is happening as well, something that we possibly can't quite quantify at the moment, something societally with the general population, potentially economic factors, and possibly an increase in dangerous suicide methods. So there are already some groups that we're concerned about here. I already mentioned that there was no rise just for this year in young people. There was also no rise in men in their 40s and early 50s. And one of the reasons that I want to draw attention to these two groups is that there's been a particularly concerted effort in suicide prevention for these two groups. And we hope that we might take some positives from that. Next slide, please. So as I say, the national suicide figures as released, they don't relate to COVID-19. There is this lag in collection of national suicide data. So what do we know about suicide prevention and self-harm prevention during COVID-19? I want to tell you about, well, I'll be talking about quite a few new publications in these few minutes. I want to tell you about this publication that's come out just this week by colleagues working in suicide prevention in Swansea and Bristol. What they're doing is essentially a living systematic review, so an ongoing fast-track review of all of the emerging evidence that relates to self-harm and suicidal behaviour. And this is the first publication from that living systematic review that's been released. Now, to date, all of the relevant publications that were included in this review reported observational data, and there was no report that could look at the changes in rates of suicidal behaviour over this time period. The reviewers recommend that all future research needs to improve the quality of the design and the method and reporting. And essentially one of these early conclusions that we get from this information, from this living review, is that there is no reasonable data at the moment on suicide rates or suicidal behaviour during the current pandemic. Because partly due to the lack of data, the authors also conclude that there's no clear evidence of an increase in suicide or suicidal behaviour associated with the pandemic, which is a concern that many of us have. Next slide, please. So when we don't have the data on the actual suicide rates, what we can do is look at some of the other data that's being collected in terms of evidence that people have been struggling. And this is taken directly from another report that was just out this week, which I strongly recommend you look at, which is the Public Health England Mental Health and Wellbeing Surveillance Report. This is something else that's being regularly updated. And what they're doing here is collating information from several studies, again, similar to the systematic review, so that we can see evidence of mental health and wellbeing changes over the time of this pandemic. The graphs that I've shown on this slide are actually taken from the University College London COVID social study, which is a really important study that's been collecting information from tens of thousands of people on self-reported variables since the beginning of lockdown. And I've just chosen two graphs to report on this slide. You can see anxiety and depression, and this is self-reported. And we can see in both instances that anxiety and depression were both higher than the baseline rate at the beginning of lockdown. But over the time period of lockdown and to the most recently reported data, they both seem to be decreasing, anxiety slightly more markedly than depression. It's worth saying that people who had a diagnosis of mental illness had, as we might expect, higher reported symptoms than people who didn't have a diagnosis of mental illness. And in the last few weeks, what we're seeing is that people with a diagnosis of mental illness are seeing greater reduction in their symptoms. So a possible narrowing of that gap of the experiences of people who do have a diagnosis of mental illness and people who don't. Next slide, please. Again, this is taken from the Public Health England Mental Health and Wellbeing Surveillance Report, but the data itself is from the UCL COVID social study, who asked people about their thoughts of death and self-harm, and also about self-reported self-harm itself. And you can see that there's really been no change in what people have told us about what people told University College London about self-harm over both lockdown and more recently. Now, there's starting to be some evidence as well that hospital attendances for self-harm actually decreased during lockdown. Some of this is unpublished data taken from the multi-centre study for self-harm, who some of you may be aware of, collect information on all hospital attendances following self-harm in hospitals in Oxford, Derby and Manchester. And they've worked hard to bring forward that reporting to have something resembling a real-time surveillance of hospital self-harm attendances. And there's been some other publications coming through as well, looking at hospital attendances for self-harm. Now, the fact that people have been less likely to attend emergency departments following self-harm doesn't mean that I think that self-harm has decreased at all. I think that actually what this is reflecting is something that's happening with our health services and with a change in help-seeking behaviour. So during lockdown, there's a possibility that people didn't feel that they could seek help from the usual places when it comes to self-harm. And we've also heard from colleagues and seen some reporting in the media of an increased demand on third sector organisations. So third sector organisations, particularly working with people who self-harm, who are in distress, who have suicidal thoughts and behaviours, have reported an increase in engagement to their services, and that people may be accessing services in a different way, not going directly to the NHS. Next slide, please. So I've said that there's not a huge amount of evidence to date about suicide rates, about self-harm during this current pandemic. And I want to talk a little bit about what data and evidence we do need to be able to learn from research in the way that we usually do. I've already mentioned the early notification of the self-harm hospital attendances, and that really is telling us something about service engagement more, I think, than it is telling us about self-harm. It's also important that we try to get earlier notification of suicides. So by that, I mean real-time suicide surveillance in the general population, in mental health patients, and in children and young people. So within the general population, Public Health England have been working with local areas to, in some instances, set up, or from some places who already had systems set up, to collate data on suspected suicides that have occurred in their general population in a real-time way. And we're nearing the stage where we may be able to start learning lessons from this data to see what has changed in terms of suicide rates, suspected suicide rates, over the time of the current pandemic. Some of you know the work that we do at the National Confidential Inquiry into Suicide and Safety in Mental Health is collecting information on people who've died by suicide after they've been in contact with mental health services. We've also set up a real-time surveillance system within mental health services. And this is us essentially asking clinicians to complete a brief questionnaire for us on any deaths that they're aware of from patients who've been in contact with their services. And we're also collecting information specifically about COVID-related factors. We're hoping to be able to turn that around relatively quickly and learn from the characteristics as to whether anything has changed for the people who are dying by suicide during the pandemic. And also children and young people. The picture on the slide there is from the National Child Mortality Database report that came out earlier in July. And the National Child Mortality Database was something that was already running, and they were able to, through their data set, isolate children who died by suicide, and we could learn a few lessons from there. And what we learned looking at that data is that there's a signal, if you like, that there may have been an increase in child and young people's suicide during the early part of lockdown. But really the data, the numbers are far too small to make any definitive conclusions. And it's worth saying at this point that while we worry about children and young people, of course, that the rates in this group and the numbers and the risk is still low. We can also learn, as I've already mentioned, from mental health surveys and from looking at the volume of calls to other organisations. Next slide, please. But we do know the groups that we're particularly concerned about, and these look very familiar because they're groups that we were already concerned about. I think it's worth saying that it's likely that the effects of COVID-19 and social distancing measures will disproportionately affect already disadvantaged groups, and that's why there's an extra impetus to have our focus on the general population, but focusing on those inequalities, so health inequalities, people who are not white. Also, again, some of these, are themes throughout suicide prevention work and have been for the last several years. We need to focus on people with mental illness, those economically vulnerable, bereaved people, particularly those bereaved by suicide. And I've already mentioned children and young people, and there are specific risks that I'm sure you'll be aware of. Next slide, please. I did want to end on a positive note because I think it can be quite overwhelming to be working in such a different environment and to be trying to work so quickly, both in terms of research and in terms of the clinical services that you offer. I want to say that we already know what helps to prevent suicide. At the National Confidential Inquiry, we're collating evidence, which is evidence from the last several years, but relating to the specific concerns that people have around suicide prevention during COVID-19. This is something that we're regularly updating, and please do visit our website, get yourself signed up to receive information from us, as well as checking out the other resources that I've mentioned. Services have been adapting quickly to rapidly changing environments, and I think that we should be incredibly proud of the amount of effort that's gone into that. And we're starting to also see some evidence of how those changes have been perceived by staff. And lastly, just to say that we are on the cusp now of more data and evidence being forthcoming, specifically related to suicide and COVID-19. So please do keep looking at those continually updated sources. Thank you. Back to Olivia.
Thank you so much, Maudsley. Thank you. I'm now going to hand over to John Joe Hurley, our suicide prevention lead for Thrive London. Thank you, John Joe.
Thank you, Olivia. Many thanks for having me today. I'm John Joe Hurley from Thrive London, and I'm the suicide prevention lead. For those that don't know about Thrive London, I'm just going to give you a quick whistle-stop tour. But Thrive London is a citywide movement to improve the lives and mental well-being of Londoners. We were set up and officially launched in 2017, and we work with many organisations across London, from primary schools to city institutions. Our advisory board consists of MPs, police officers, academics, and those with clinical knowledge of mental health. We're on the first slide. Apologies, Olivia. We work in a variety of ways within Thrive, from campaigns such as Right to Thrive to events such as our World Mental Health Day City Hall takeover. Other ventures have included Discover Storytelling and Mental Health First Aid course for primary schools. Thrive London is growing daily and consistently tries to reach out to new communities who need our help. You can listen to us on our podcasts, you can take part in our campaigns, and you can volunteer through our Champions Network, or you can simply subscribe to our newsletter to keep you informed of what we're doing. The one positive I've noticed from working within Thrive is its flexibility to its approach. Healthcare and mental health certainly isn't a one size fits all. And I think the positivity of the way Thrive works is it goes out of its way to try and include those with its approach. On to our next slide. So suicide prevention is a key work stream for Thrive London, and we're the regional leads for London. Again, like Thrive in general, our approach needs to be flexible. Our work consists of an assortment of projects, events and campaigns. So projects have included the development and implementation of the first whole region real-time suicide surveillance system, as Dr. Turnbull mentioned earlier. An educational programme for school teachers and college teachers to help prevent suicide in adolescents, to help identify, to help approach, to help understand those children, those adolescents who are in need and who have been identified. The real-time surveillance system is part of a national pilot and has been replicated in other regions. The education courses have taken place in every STP within London and are moving on to their second phase of a longer duration and more in-depth planning and strategy to prevent suicides. The recent months and the current climate has prevented that project from really going on to the next level, but as soon as we can and work within schools and colleges again, we'll be out there again. And we've done that in joint work in partnership with Papyrus UK, who also have a fantastic helpline named the Hope Line. Events such as the 2019 World Suicide Prevention Day Conference and the 2020 World Suicide Prevention Day panel discussion on social media and suicide have helped increase our reach, which has been extremely important for us. The panel discussion, which was released this morning, is an excellent watch or listen, and has moved from our approach of looking within academics and clinicians to speaking with those who are involved and who are directly affected, from social media influencers to people who use social media and the internet in a positive way. On World Suicide Prevention Day 2019, this time last year, Mayor of London Sadiq Khan launched the ZSA training drive for 100,000 Londoners to complete the course. The ZSA training is a fantastic resource and we promoted it for the last year. To date, over 135,000 have completed this training and we're really pleased with those results and we want to now increase that further. So on to my next slide. So we sat down over 2 years ago and said, what do we want for London and what do we want for suicide prevention? And the phrase that sort of bandied around was a zero suicide city. And originally it was shot down. It was never going to happen. It's a target that can never be reached. So why set ourselves up for a fail? And then we spoke to more of our clinicians. We spoke to those affected by suicide and those with lived experience of suicide. And we kept coming back to the one phrase of one suicide was one too many. One son or daughter lost was too many. One mother or father lost was too many. And one friend lost is too many. The zero suicide city, whilst not a target as such, was an ambition because one suicide is simply too many. And every time we've broached it, every time we've been questioned on the phrase a zero suicide city, when we've described that, when we've reasoned why, there's never an argument against that it shouldn't be. On to my next slide. So how can this be done? We do this by working continually in the ways we have been doing, but we need to do this more and we need to do this by increasing our efforts, our accessibility and our reach. Can we increase the numbers who have completed the ZSA training? We're at 135,000 currently. Can we reach 150,000? When will we reach 200,000 Londoners, and so on? The real-time surveillance system, which is set up for the whole of London and includes multi-agency working with the Met Police, London Ambulance Service, London Mental Health Trusts and third-party bereavement support services. We can learn from the tragedy. We can understand why they're taking place, where they've taken place, how they're taking place, and we can really understand the gaps in our knowledge, the gaps in our understanding to help prevent further suicides. We need to open up the conversation to reduce that feeling of isolation, that feeling of nowhere to turn to. Opening up the conversation on suicides to stop that feeling is done by making people approachable, making people confident in having that approach, by reducing that stigma of suicide and making sure that people do have somewhere to turn to. There's so many different ways possible to make London a suicide city, and we need to be flexible in our approach to achieve that. Through using all the above and continuing to speak with our partners, with London as a whole, and you as the people we work for as well. From the real-time surveillance system, we've noticed from the very start that actually working together on one system with one goal has massively enhanced knowledge and our understanding of suicide, and we need to continue that through all our projects, through all our work streams.
John Joe, we can't hear you. I think that might be your presentation that's come to a close. Can you let's try again? Oh, you're back. Fabulous.
Sorry, apologies. So it was just on the last slide. It was thank you for your time today, and thanks for your continued efforts as well for London. And I hope you'll join me in the ambition and the challenge of making London a zero suicide city. So thank you very much.
Thank you very much, John Joe, for that presentation. We are now going to start our service of remembrance, and we'll now be hearing from our head of chaplaincy, Cameron our chaplains Ian MacDonald and Marcia Townsend, and also Dr. Nicola Byrne, who is our Deputy Medical Director and our Quality Centre Joint Lead for Patient Safety. We'll also be hearing from Imam Kazim Fatai. Cameron, I'll hand over to you now. Thank you very much.
Thank you, Olivia. Welcome on World Suicide Prevention Day to this service where we come together to reflect and remember those who have left our sides through death by suicide, but yet continue to walk with us through the memories that they have left behind. David Adam writes about death in part in saying this: the terminus is not where we stay. It is where we reach out beyond, where we experience new adventures. It is where we get off, to enter new territory, to enter new horizons, to extend our whole being. It is a touching of the future. It opens up new vistas. It's a gateway to eternity. And so we come together this afternoon for this service of reflection and remembrance at the terminus, a place where we take the opportunity to remember, a place of thanksgiving, as well as a place to remember our farewells. These memories will often bring with them sadness, laughter, tears, and maybe even some pain. And there's a poem that speaks of this. The writer is unknown, but it's called A Pair of Shoes. I'm wearing a pair of shoes. They are ugly shoes, uncomfortable shoes. I hate my shoes. Each day I wear them, and each day I wish I had another pair. Some days my shoes hurt so bad that I do not think I can take another step. Yet I continue to wear them. I get funny looks wearing these shoes. They're looks of sympathy. I can tell in others' eyes that they are glad that they are my shoes and not theirs. They never ever talk about my shoes. To learn how awful my shoes are might make them uncomfortable. To truly understand these shoes, we must walk in them. But once you put them on, you can never take them off. I now realise that I'm not the only one who wears these shoes. There are many pairs in this world. Some people are like me and ache daily as they try and walk in them. Some have learned how to walk in them so they don't hurt quite as much. Some have worn the shoes so long that days will go by before they even think about how much they hurt. But no person deserves to wear these shoes. But because of these shoes, I'm a stronger person. These shoes have given me the strength to face anything. They have made me who I am. I will forever walk in the shoes of a person who has lost a loved one.
This year, we are also remembering those who have died due to COVID-19 pandemic. A pandemic that has brought with it sadness, fear and uncertainty. And if it were not for the pandemic, then many of those we have lost may still have been with us. Dorothy Duffy wrote the following lines about her sister Rose, who died at the age of 81 in a nursing home in England. Rose died on April the 4th. Dorothy reminds us in her poem that behind all the statistics that we got used to hearing and reading were people who were loved and cared for. My sister is not a statistic. Tomorrow, when the latest death-o-meter of COVID is announced in sonorous tones, whilst all the bodies still mount and curl towards the middle of the curve, heaped one on top and alongside the other, my sister will be among those numbers, among the throwaway lines, among the platitudes and lowered eyes, an older person with underlying health conditions, pitiful way to lay rest the bare bones of a life. My sister is not a statistic. Her underlying conditions were love, kindness, belief in the essential goodness of mankind, uproarious laughter, forgiveness, compassion, a storyteller, a survivor, a comforter, a force of nature, and so much more. My sister is not a statistic. She died without the soft touch of a loved one's hand, without the feathered kiss upon her forehead, without the muted murmur of familiar family voices gathered around her bed, without the gentle roar of laughter that comes with memories recalled, evoked from a time that already seems distant, when we were connected by the simplicity of touch, of voice, of presence. My sister is not a statistic. She was a woman who spanned the 7 ages, a mother, a grandmother, a great-grandmother, a sister, a friend, an aunt, a carer, and a giver. My sister is not a statistic. And so she joins the mounting thousands. They are not statistics on the death-o-meter of COVID. They are the wives, mothers, children, fathers, sisters, brothers, the layers of all our loved ones. If she could, believe me when I say, she would hold every last one of your loved ones, croon to and comfort them and say, you were loved. Whilst we have been left behind, mourn deep, keening the loss and the injustice and the rage. One day we will smile and laugh again. We will remember with joy that once we shared a life, we knew joy and survived sadness. You are my sister, and I love you.
Just as the candle lights the darkness, we hope that this time of reflection and remembrance may in some small way shed a light on your journey, and may the light of love comfort you in your grief. And so as these 4 candles are lit, in honour of those we love, cared for and miss, this candle represents our grief, the pain of losing one that we loved, as well as our courage to confront our sorrow, our sadness, but also to take comfort from each other.
This candle represents our loved ones. Memory, remembering the times we laughed and the times we cried, the silly things we used to say and do, the caring and the joy that they brought into our lives. You're on mute.
This candle represents those in the caring professions who, often without thoughts of self, seek to look after the one we entrust into their care. And so we remember their dedication, professionalism, selflessness, and love.
This candle represents the light of love. Day by day we cherish the special place they have in our hearts, a place that will always be reserved for them. And as we have lit each candle, we simply thank those whom we remember and continue to love for the gift their living brought to each of us.
an introduction to a reading by Naomi Shihab Nair, a contemporary poet of American Palestinian background. Is a writer about kindness, a way of life, rather than a series of decree acts. Kindness is not bland pleasantry, but an expression of deeply felt communion. Kindness is born out of toughness of life. She writes, before you know what kindness really is to you, most loose things, feel the future dissolve in a moment like salt in the weekend broth. What you held in your hand, what you counted and carefully saved, all this must go, so you know how desolate the landscape can be between the region of kindness. How you ride and ride, thinking the bus will never stop. The passengers eating mares and chicken will stare out of the window forever. Before you learn the tender gravity of kindness, you must travel where the Indian in a white poncho lies dead by the side of the road. You must see how this could be, how he too was someone who journeyed through the night with plans and simple breath that kept him alive. Before you know kindness as the deepest thing inside, you must know sorrow as other deepest thing. You must wake up with sorrow. You must speak to it. You must speak to it till your voice catches the thread of all sorrows and you see the size of the cloth. Then it is only kindness that makes sense anymore. It's only kindness that ties your shoes and sends you out in the day to mail letters and purchase bread. Only kindness that raises its head from the crowd of the world to say, it is I you have been looking for, and then goes with you everywhere like a shadow or a friend.
The after-loss creed has become known as the voice of the bereaved, gently explain to the others how bereaved people feel, what their needs are, and what others should say and do to help them as they recover from their loss. After-loss creed by Barbas Lisgran says, I need to talk about my loss. I may often feel the need to tell you what's happened or to ask you why it happened. I may frequently need for you to listen while I explain what this loss means to me. Each time I discuss my loss, I'm helping myself face the reality of the death of my loved one. I need to know that you care about me. I need to feel your touch, your heart. I need you just to be with me, and I need to be with you. I need for you to believe in me and in my ability to get through this grief in my own way and in my own time. Please don't judge me now or think that I'm behaving strangely. Remember, I'm grieving. I may be in shock. I may feel afraid. I may feel deep rage. I may even feel guilty, but above all, I hurt. I'm experiencing a pain unlike any I've ever felt before. Don't be concerned if you think I'm getting better, and then suddenly I seek to slip backward again. Grief makes me behave this way at times. And please don't tell me you know just how I feel, or that it's time for me to get on with my life. I'm probably already saying this to myself. I just need for you to be patient now and to try to understand. Finally, Allow me the time I need to grieve and to recover. I want to get on with my life, but I know that first I must walk through the dark shadows of my grief. And although it is almost impossible for me to believe this now, I know that one day my grief will end. Most of all, thank you for being my friend. Thank you for caring, for helping, for understanding. Thank you for praying for me. And remember, in the days of years after your loss, when you need me as I've needed you, I will understand, and then I will come and be with you.
As we come to our time of remembrance, someone wrote this. I know for certain that we never lose the people we love, even to death. They continue to participate in every act, thought, and decision we make. Their love leaves an indelible imprint in our memories. We find comfort in knowing that our lives have been enriched by having shared their love and their lives. And as we remember those who are closest to us, we bring their names forward in a moment of silence together. Let us remember.
Ian, could we have that again on without mute?
My apologies. I said that I would remember the act of remembrance. I placed a heart to remember my loved one who died many years ago. And also I placed those names with the names that we placed there last year to remember those who have gone before us. And to remember those whose names we will place there today, so that they too will be remembered. And now I read, please say their names. The time of concern is over. No longer are we asked how we are doing. Never are the names of our loved ones mentioned to us. A curtain descends. The moment has passed. Lives slip from frequent recall. There are exceptions. Close and compassionate friends, sensitive and loving family. Still look, still ask, still listen. Thank you for them. For most, the drama is over. The spotlight is off. Applause is silent. But for us, the play will never end. The effects on us are timeless. What can be said, you ask? Please say their names to us. Love does not die. Their names are written on our lives. The sound of their voices replay within our minds. You may feel they are dead. We feel they are of the dead, and still they live. They ghost walk our souls, beckoning in future welcome. You say they were yours. We say they are. Please say their names to us and say their names again. It hurts to bury their memory in silence. What they were in flesh is no longer with us. What they are in spirit stays within us always. They were of our past, but they are part of our now. They are our hope for the future. Please understand we cannot forget. We would not if we could. We know that you cannot know. Yesterday we were like you. Understand that we dwell in both flesh and spirit. We do not ask you to walk this road. The ascent is steep and the burden heavy. We walk it not by choice. We would rather walk it with them in the flesh. Looking not to spirit worlds beyond. We are what we have to be. What we have lost you cannot feel. What we have gained you may not see. Please say their names, for they are alive. We will meet them again, although in many ways we have never parted. Their spirits play light songs, appear in sunrises and sunsets. They are real and shadow. They were and they are. Please say their names to us, and say their names again. They are ours, and we love them as we always did. More each day. Please say their names.
As we come to the end of this service of reflection and remembrance, hopefully one theme has come through, that people are not statistics. They're people who are loved and cared for very deeply. And although they might not walk with us in person just now, they certainly continue to walk with us by our sides, in our memories, but above all in our hearts. That's why the image of the heart is so important to us within the chaplaincy team, and why we write people's names and keep them together in a box shaped as a heart. Because I believe, for one, as do the rest of the team, that we in the chaplaincy are the Trust's corporate memory for those who have gone, those who have left our sides, either friends and colleagues or members of our families. So if you would like your loved one remembered today, not just through what we have done, but their first name written on a heart and kept within our corporate memory, please send in their first name to the chaplaincy team, and that can be emailed at chaplaincy@slam.nhsuk. That's chaplaincy@slam.nhsuk. And we promise we will honour them by writing their first name on a heart individually and place it within our corporate memory so that they will not be forgotten by you, not that they ever could be, but more importantly, by the organisations who are represented here today, because hopefully you've seen throughout the whole conference that there are people in all parts of the health service and care teams who care incredibly deeply for those who are lost to us, either through suicide or through death in COVID-19. And so today, we've remembered people of laughter, we've honoured people of care, and yet, you and I, we still feel a sorrow in our hearts, and sometimes a sense of sad despair. But if we are want to give them the honour that they're due, We must hold on to all that they were, the good, the kind, and the true. We remember their uniqueness, their compassion, and maybe even their calm. The overwhelming pain of loss will find in our memories a soothing balm. So let us talk about the good times and the way that they showed that they cared, the time that we all had together and the experiences that we shared, that their memories surround us. And a word someone may say may suddenly recapture a moment, a time, an hour, or a day. And maybe tonight, when you and I look up at the evening sky to see that twinkling star, the star that sparkles brighter than the rest and doesn't seem quite so far. Or if we keep those moments, then we will never be apart. And they will live forever, safe within our hearts. On behalf of everyone here during the service, I'd like to say thank you very much indeed for taking part and listening to it and being part of it. But more importantly, for allowing us to be part of your story, because your story is so very personal and so very much love-filled. Thank you. Olivia, back to you.
Thank you to you all for your service of remembrance. I'm now going to hand over to our chair of South London and Maudsley, Sir Norman Lamb. Norman, I'll hand over to you now. Thank you very much.
Thank you. And can I start by thanking all of the people who've been involved in organising today's event. It's really important that this event takes place, and I'm grateful to everyone who's made it possible. Can I thank also everyone who's contributed today to the event, and to the chaplaincy team for their contributions, but also for the work that they do on a continuing basis. I think it's really important that we remember all those who've lost their lives through suicide. Remember also those who've lost their lives during this COVID pandemic. But I think it's also important that we remember all those who are left behind following the death of a loved one. And remember also all those frontline professionals who work with highly vulnerable people, keeping them safe. But when tragedies do occur, there will be a lasting impact on them as well. And we need to show solidarity with them. And I am very keen that as we move forward with our organisation, that we have an open and a learning culture, so that when tragedies do occur, we don't cast around for blame, but we learn together from those tragedies in order to prevent further tragedies from happening in the future. The next thing I wanted to say is sort of by way of personal disclosure. I lost my oldest sister, Catherine, to suicide in 2015. In her mid-60s, after a period of deep clinical depression after our mother died. And so our family has been through the same trauma and the same grief that so many other families have been through in our country and globally. Remember the point that Angela made, that 800,000 people across the world lose their lives through suicide every year. And our family's experience has strengthened my resolve to understand more about what we can do to save lives. And I wanted to reflect for a moment or two on the concept of zero suicide. It was great to have John Joe speaking to us today. And I've noted some of the comments that have been made, which are legitimate and serious comments, including one which made the point that some frontline health professionals feel uneasy that they will face blame if a death occurs after embracing the concept of zero suicide. Well, I come back to what I said earlier, that our culture in healthcare organisations should be one of learning and not of blame. It should be a just culture so that we learn lessons to prevent further tragedies in the future. But I learned about zero suicide, first of all, when I was minister back in, I think about 2013, and I was on a visit to Merseycare, and Joe Rafferty, the chief executive of Merseycare, told me how he had learned about it from the work that they'd done in Detroit in the United States. And in Detroit, the healthcare organization there, led by Ed Coffey, had embraced this idea of seeking to save every life. It was a patient safety initiative. It wasn't a target. That's really important to understand. It was an ambition. And they asked themselves the question, what number of suicides is acceptable within our organization? And there can only be one answer, and that is that we seek to save every life. Surely that must be the case. And so setting an ambition of zero suicides, audacious though it is surely the right ambition to have. But the idea of zero suicide is to match an audacious ambition with the application of science, of evidence, of what is effective at saving lives. And there is now a lot of evidence globally as to how we can be more effective in saving lives. But here's the thing. In the International Declaration on Zero Suicide that was first made in 2015, there was a really telling graph which struck me as vitally important. It showed that in diseases like stroke, with heart disease and with HIV/AIDS, globally, we have managed to dramatically reduce over the last few years the mortality rate from those conditions. And then you look at the line for suicide, and globally it is level. We have not made impact yet on that 800,000 people who lose their lives through suicide. And yet we have so much evidence about how we can save lives. And so it seems to me that there is a moral imperative that we do better, that we commit to an audacious ambition, but that we match that with the application of evidence. And I think all healthcare organisations should seek to embrace this concept. And if by working together, we can save lives by being more focused, by being more disciplined, by being more effective at applying the evidence of effective strategies to reduce loss of life, then that surely is a goal that's worth pursuing. So I end, Olivia, by again remembering all those people, including my sister Catherine, who have lost lives through suicide, remembering all those loved ones who are left behind, and remembering all those people who work on the front line, who deal with these tragedies and have to live with the consequences, and with whom we must show solidarity. And let's use this as a call to action to save lives in the future. Together, we can make a difference, and we have an obligation to do so. Thank you very much.